Welcome back to Beaufort County News and Views. I'm Catherine Glover, and I'm the director of the Washington Beaufort County Chamber of Commerce. Speaking tonight with Dr. David Dirks, and he's with Dirks Chiropractic, which is located in Washington and Winterville. Welcome back.
Thank you.
You just opened the store in Winterville? Is that right?
We did. We opened in Winterville this past July, and we started seeing patients. And yeah, it's kind of considered South Greenville, I guess you'd say. So we pick up folks from Greenville, from Snow Hill, Ayden, Grifton, all that southern Pitt County area.
Where are you in the practice by yourself?
I am at current, yes.
Okay, great. So you're in both locations to just if somebody wanted to make an appointment. If they're closer to Greenville, they could go to the Winterville office. If they're closer to Washington, they could come to yours. Yeah, absolutely.
We're in the Winterville location 3 days a week, Monday, Wednesday, Friday, and then at Washington on Tuesdays and Thursdays. And, the two communities are so interconnected. We see patients one day here, and, the next time they come in, they might be easier to go to the other location. So really, it's interchangeable.
Very neat. So we've talked a little bit about obviously why you went and decided to be a chiropractor. And we talked a little bit about coming to you for maintenance and also for injuries or other things like that when you wake up and you have those acute things that happen or maybe long-term things. Talk to me a little bit about the disc problems and other things that you see patients for.
Sure. The disc is people commonly refer to as a slip disc, possibly. Every section of the spine has the vertebrae that stack up on top of each other. And then in between, there's a little cushion that's called the intervertebral disc. That little cushion is made up of an outer rim that holds a jelly in the center, kind of like a tough jelly donut, I guess you could say. And when a disc slips, or commonly called herniated or protrusion, some of that jelly starts to push out towards the backside of the spine, left or right, and that will often cause pressure on one of the spinal nerves that we talked about earlier. The spinal nerves tend to come from the neck, down the shoulder, down the arm. Pain, tingling, numbness, burning are common symptoms. Also the sciatic nerve going from the lower part of the spine, down the hip or the butt area, back of the leg, calf, down into the foot. So you've got pinched nerves that come from the disc in the neck or the back are very common. That disc, typically when we see this in the chiropractic office, it's considered a contained disc, a form of herniation called a protrusion. So if you have a herniation or a protrusion, oftentimes we can help that in a conservative manner by doing what are called adjustments. We certainly often work with therapy like hot and cold and electrical stimulation to treat muscle spasm. And very importantly, long-term, that people strengthen the muscles around the neck and the back. Chiropractic is very important to help people with disc protrusions or herniations, but the strengthening process afterwards, because it is a chronic condition. Unfortunately, whether you have chiropractic, physical therapy, or surgery for a disc protrusion, it's always going to be a weak spot. So the best thing long-term is to strengthen that area, and we can help you with that as well. We do chiropractic adjustments for these disc protrusions. Certainly, if there's an element that doesn't respond well or that needs further aggressive attention, we refer to orthopedic or neurosurgeons, as I mentioned before. They have a host of things like spinal injections and surgery, but we do everything we can to avoid that. And most people feel the same way. And even the surgeons feel the same way. Oftentimes people do have spinal injections, but they also continue with chiropractic care, again, to try to treat it in a conservative manner without surgery.
How important is it for people, like, say someone wakes up, or if they're in the car wreck or something like that, and they know that something is wrong? How important is it, based on time, to get to you?
Great question. When you have an injury, say it's a slip and fall, or you twist and turn wrong, strain yourself, or get in a car wreck with a whiplash type of injury, there is a time clock that starts. And usually that's anywhere from about 6 to 8 weeks. The first 6 to 8 weeks after an injury is very important. The body first starts to become inflamed. So most of us have twisted your ankle. You twist your ankle today, it hurts a little bit. Tomorrow morning it's all swollen, you can't put your weight on it. That's the inflammatory phase, that first about 2 to 3 days, so up to 72 hours. Then your body starts to lay down collagen, which is scar tissue. It automatically lays down collagen to repair muscles, ligaments, disc, tendons, all those soft tissue that become injured. During that time, that 6 to 8 weeks, that your body's laying down collagen and trying to repair neck and back injuries, the most important thing I can do as a chiropractor is to restore the normal motion to the spine, restore the normal motion to the joints and the muscles. If the normal motion isn't returned within that 6 to 8 weeks, more than likely it becomes a chronic issue, an ongoing problem. And we even find that after surgical cases. You have your knee replaced, all kinds of scar tissue forms. The first thing therapists and doctors do is get the motion back. It hurts, keep moving it. Because they know if you don't move it, you're going to lose it. It's going to form scar tissue, form arthritis. So that time frame is important. If you get in an injury and you wait 2 or 3 months, that scar tissue is already formed. If the normal range of motion hasn't returned, probably little you can do to get back to normal at that stage.
But there's things that you can do to help treat the pain, the chronic piece of it.
Absolutely, yeah. If for some reason you've waited a year or two and you're still having problems, if scar tissue has formed, if degenerative changes have formed, our goal is still to help relieve pain, restore normal motion, restore normal function. I want to get back to dancing. I want to get back to walking. I have an interesting gal that I'm treating now that when she came in, I said, "Oh, what can I help you with?" She goes, "I want to reduce my hemoglobin A1C." I said, "What?" She goes, "Well, my knee hurts, so I can't walk, so I can't. I'm diabetic." So everybody's goals are different, but we can still help people with chronic conditions as well as acute conditions.
So they can come to see you at any of those different stages.
Sure.
Obviously, you encourage people to come in the earlier stage.
If there is an injury, earlier the better. So there's plenty of studies that show long-term degenerative changes, especially in the neck and the cervical spine, are related to injury or trauma. Several years down the road, you form bone spurs and disc degeneration, and those are the chronic degenerative changes that occur after an injury several years down the road if they're not treated properly to begin with.
Great. We're going to take a quick break. We'll be back in a minute with Dr. David Dirks with Dirks Chiropractic.